we see people dying all the time, which is desperately, desperately sad. We had over 20 of my patients die last year, and the average age of the patients who died was about 47, 48. You know, these are not faceless, nameless people. They are known. They have families, however broken they might be. They have friends who might have given up on them, but who still love them. And they're known to us. And so we sort of, you know, each one of them that dies hits us hard. And then many of them don't die, but remain dreadfully unwell. So people can be on the streets with dementia, with heart disease, with lung disease, with liver failure, with people on the streets dying in pain because of their conditions, but us not having the resources to help them in the way that we want to be able to help them. It's really quite shocking, and it's very, very tough to see as a clinician, as a human. It's very, very tough to see. People being found dead, sometimes through unintentional drug overdoses, sometimes through heart problems, and we don't know whether the stress of the cold and their physical ill health as well contributed towards the heart problems that killed them. Many of the people that we see sleeping on the streets are people who as children and as teenagers have suffered violence and neglect, and who now as adults are suffering violence and neglect, and are some of the most vulnerable, traumatized people in our society, and yet we're letting them live on the streets in a fundamentally unsafe place. Whenever we speak to a nurse or a doctor or physiotherapist, whoever it might be in the hospital, you know, by and large our experience of them is fantastic, and they want to help as much as they can. But by the same token, we know how stretched hospitals are. We know that there's a 4 or 5 month waiting list in Brighton for simple outpatient appointments. And then you put in one of our sort of chaotic, challenging, unwell patients into the mix. It can be quite an explosive mix, and it can make people's lives very difficult. And hospitals are all about this sort of treadmill of care. How many people can we get in at the beginning, whiz them through care and get them out at the end as fast as possible with as little money being spent on them as possible. And that's necessary. I understand why that might be. The difficulty is that our patients can't fit that. They can't do it. They can't play by those rules because they're too complicated psychologically and medically. The truth is that many of the homeless people we see on the streets are very unwell in many different ways, and their lives are vulnerable. And so it feels a bit like being on the front line, really. We're going to keep on doing the best that we can in the face of this adversity and in the face of this suffering to improve things.